Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi everyone, we're the Smile Sisters. Yes, we are. Today we are going to talk about PRP. Yes, PRP, a wonderful substance that's almost magical, I want to say.
Magical.
It's a magical substance.
That's a good way to look at it. It's coming from your own body.
It is.
Right?
It's from your blood.
So let's take a step back. Why are two dentists talking about PRP? How does it relate to dentistry at all?
Well, first of all, PRP, it has been used in other medical disciplines, for joints or for other things, a lot in cosmetics.
Sure.
And what it does is just, it promotes healing. So in any part of your body where you place it, it promotes healing. So obviously when you're doing surgery, you want healing. So now we're starting to use it a lot more in all types of dental surgery and dental applications.
Okay. So what does it stand for?
First of all, let me tell you, PRP is from your own blood. So this is kind of maybe a little bit of a weird thing that if you go to the dentist, they will like draw blood from your arm.
Sure.
But we do draw blood. We take that blood and we spin it. So whole blood is a mixture of different things, red blood cells, white blood cells. And then when you centrifuge that, it actually separates into 3 layers.
Sure.
The bottom layer are your red blood cells. And then the top layer is the plasma. In that middle layer is a layer called Platelet-Rich Plasma. And what that is the plasma, but then it has all the platelets, the white blood cells, everything that you need to heal and to
recover.
And to recover and to clot, like all those clotting factors that when you cut yourself, you get a blood clot. Those are all basically concentrated in that middle layer.
And that platelet-rich plasma
That's
layer
right.
of your blood.
That's right. And so we then take that little middle layer and we place it back into wherever surgical site, either the socket of an extraction or, if we're doing like any kind of like a flaps or gum surgery, we put it under there. Yeah.
So the purpose of using your own blood in that region is to promote healing.
Yes.
And so let's talk a little bit about statistics of healing. Like how much does using PRP when you do an extraction help in the healing process?
I actually don't know any like studies and statistics. I'll look it up for a next episode, but just from our practice, I think we've been using it for like 2-3 years.
Yeah.
I don't think we've seen dry sockets since we've been using it.
Exactly.
The swelling, bruising, post-operative pain, all of those things I see has been dramatically decreased.
Yeah.
So I try to use it all the time as much as I can. As much as people will allow me to, I will use it and help with the recovery.
In fact, isn't it true that it's become so successful? We've seen such an improvement in the post-operative outcome after surgery that it's become a requirement when removing wisdom teeth.
Yeah,
our practice.
We basically turn people away who don't want to, follow our recommendations in certain things like this, especially in those more difficult, impacted, if you're older, and the root is fully developed. And if you don't want to do these kinds of things, like we won't see you. We don't have to necessarily see every single person.
Sure.
So we will actually turn you away if you don't want to follow certain recommendations, because we really feel like for a successful outcome, like first of all, don't smoke, be healthy, like all that stuff. But also adding this really helps to like promote that extra layer of healing.
Yeah. And it's almost a disservice not to do this when you have the capacity to provide this and improve the outcomes. Because people have so many horror stories about having their wisdom
That's
teeth
right.
removed and the swelling, and you see,
Yeah.
videos
And I
of
just
people's
feel like
faces.
having been doing this for over 2 decades, I don't have to see everybody. I don't have to take every tooth out, and I want to get good outcomes. I want my patients to be happy. So I know what I need to do for that to happen. And PRP is definitely one of those things.
Yes.
And so I've come to a point in my career where I'm at the point where if you don't want to do these things, that's okay. I don't have to be your dentist.
True.
But I really, really believe in it, and I think it's really added to our practice in the last few years a lot.
Yeah.
Yeah.
So we talked about it. So let's talk about how is this actually done in the office. So if I come in and need my wisdom tooth out and I've agreed to do PRP, what happens when I sit in the chair?
First is if you're getting sedated, we will start sedating you first. So you don't, so it kind of like takes the edge off of everything. So we will start sedating you. And then as part of starting the IV in your arm to start the sedation, we actually take blood out first before we start putting any medications in. We usually take about 4 to 6 tubes, I want to say, which is, I would say like a medium-sized amount of blood. And then we take that blood and we put it in the centrifuge. While I'm doing the surgery, one of our other assistants is centrifuging the blood. And then once the tooth is out, we clean everything, we debride everything, and then we place the PRP into the socket. And then we suture it all together.
You're talking about that middle layer of the blood. So they centrifuge it. So
That's right.
the blood gets split into 3 layers in the tube.
And then they take out the middle layer, they cut out the other 2 layers, and they just bring me that middle layer in a tray. It's wonderful.
And it looks like a slug.
It looks like it's a slimy slug.
Yeah, it looks like a very slimy slug, right?
It is.
So then you take that slug, and after you have taken the tooth out, you just physically put it inside of the hole.
That's right. You physically pack it in there, pack a few in each socket, and then we suture it down so it really stays in there.
Right.
Yeah.
So that slug can be flattened to become a membrane as well. It can also be mixed with bone. Let's talk about the other uses of PRP in other situations.
Yeah. So like we said, we can take it and just pack it into the socket. Or let's say you do a bone graft. You can flatten it and make it like a thin, like membrane layer, and then put it over the bone, then close the gums over that. And what that does is that it promotes healing of the gums. So it helps the gums close faster. And finally, like you said, we can actually mix the more liquid PRP with bone graft, and it creates a thing called sticky bone, we call it in dentistry.
It's kind of like a gummy bear consistency.
Yeah, it's like a gummy bear bone. And then you take that and you place it into, if you're getting an implant, you're getting bone grafting, you can use this sticky bone gum. And then that actually holds its shape better than just like the little particles of bone that are more like a powder.
Sure.
So you can like shape it, and then we put the PRP membrane over that. So you have it inside the bone, you have it over the bone, and then you have your own gums over all of that. So it's kind of like incorporating it into every aspect of the surgical.
So you can have it mimic your bone consistency by making it into gummy bone. You can have it mimic the gum tissue consistency by flattening it out like a membrane. And it's quite strong. When you flatten it, you can, you can
like really stretch it. And it's a crazy material. it's like a miracle.
Body. And it comes from your own body. And it promotes healing.
Definitely. You're not going to have any like negative reactions to it. It's your own blood. Yeah. So there's no risk of like, bad reactions or allergies or anything like that. And finally, I do want to talk about aesthetics, because a lot of dentists do aesthetics. We don't, but PRP is used a lot in
dental and facial aesthetics.
Facial aesthetics.
Yes.
Yeah.
So we can talk about different interesting uses for it. So some people use it to inject instead of fillers that are synthetic, that you can inject. You can also inject PRP under your skin.
Yeah.
And it promotes the making of collagen in that area.
It promotes your own body to create more collagen.
Sure. Right.
So you can use it instead of fillers under the eyes or around the lines of the mouth or kind of like these lines.
Yeah.
So it's got multiple uses. We don't do aesthetics here in California. We're not allowed to, but I know many, many dentists do that.
Yes.
And PRP is an amazing substance for that. Again, you're not gonna have an adverse reaction. It's not anything synthetic that you're injecting. It's your own blood. So,
and when it comes to using it as a filler, it has, of course, no allergy, no issues like that to it because it's made out of your own tissue. Also reduces the chances of other serious effects of having filler done, like occlusion of the vessels. You can't occlude your vessels with this.
By occlusion, you mean like blocking the vessels.
Exactly. So if you get filler placed and it's placed by mistake inside of a blood vessel, it can have some complications that this material avoids.
Right. Even if you inject it directly into a blood vessel,
It just dissolves.
it's blood. So it's actual blood going back into blood.
Yes.
So, okay. It's a wonderful material. We love it. And it's one of the things you can do to really minimize your risk of post-operative complications like dry socket, swelling, pain, infection. So I would recommend you at least ask your dentist about it if you're getting your wisdom teeth taken out. I think most dentists are very familiar with it,
But not a lot of general dentists provide this as a service.
right.
But anyone who does probably wisdom teeth extractions frequently will have this ability to do it.
Yeah.
I think it's becoming more and more common now.
I think so.
Dentists.
Yeah.
But it's really just a benefit to the patient, and that's why we offer this, because it really, really reduces the complications. So dry socket is like the number one sort of post-operative issue that happens with wisdom teeth extractions or any extractions, correct?
Right. Well, yeah, sure. Yeah.
Yeah.
I don't know if it's the number one.
Okay.
I think
It's a common one.
it's a common. It's something. Yeah. People are really afraid of it, I think.
So dry socket is when you get a secondary infection in the area where the tooth was taken out of,
Okay.
right?
Yeah.
And so why does that happen?
And there's no blood flow. Basically, you just have a wall of bone. So what we like to see, okay, when we take a tooth out, we don't want to just see this bone. We want to see blood. We want to see that hole fill with blood. And dry socket is when there's no blood, there's no clot. It's just like the wall of bone. It happens really, I think the most common reason is smoking. Smoking causes it.
Sure.
But PRP is actually kind of mimicking that blood clot. So when we take the PRP and put it inside the socket, it's as if you already had a clot in a way. So that's why it really helps with dry socket. I think there's actually a dentist, I don't know where, it's not in California, who is advertising that they'll do, if you get PRP and you get a dry socket, they'll refund you.
Oh, it's like a guarantee.
It's like a guarantee. Like, that's how good it is.
But like you said, it is, I mean, I would think it would be a good guarantee because we haven't seen dry sockets.
Yeah, you
since
don't
doing
see it. I
therapy.
think they're making money on their guarantee.
Yeah. And it used to be a pretty common side effect.
Yes,
having
for sure. Yeah, and it's kind of like you can really avoid it.
And dry socket can be quite painful. Usually arises a few days after the extraction and can be super uncomfortable and cause more complications, especially if you are trying to get an implant or something like that in the area.
Yeah. You want to avoid it for sure. And definitely smoking. I think, like we've talked about it so many times, don't smoke. But you can't say it enough because it's just, people just go back to their habits.
Of course.
But smoking, don't smoke and get PRP, and your chances of dry socket are minimized.
Very good.
Yeah.
Okay.
Good.
On that note,
Yeah. So PRP, hope it was useful.
see you next time.
Okay. Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.